Hi, this is Sharon David, Dr. David. I'm back from Fort Wayne, Indiana. I got a lot of great responses on the last conversation with Marina Castellanos about stress urinary incontinence. So just wanted to follow up with another video that people asked questions about. Sex after baby. Sometimes that can be very painful. So Marina, thank you again for joining us. Appreciate having you here with us.
Oh, it's my pleasure. Thanks for asking me back. I'm so happy that people were asking questions and, wanting to know more from our first video. So I'm really happy to get to, do this again and discuss another topic with you.
What are you seeing in your clinic when patients come in and talk to you about painful sex after babies?
So there's a couple of different things. So first, there might be a new mom who comes in who hasn't even attempted to have intercourse yet and is nervous about trying to resume intimacy with her partner. So there's that. And then there's people who, okay, they gave it a try and they discovered that, not only does it feel differently than before they had a baby, it is now uncomfortable and is now painful. So in any case, they end up finding me, and the good part is that there's so much we can do to help. So for women who get their clearance at 6 weeks from their doctor or midwife, they're told they can go ahead and resume physical activity if everything's healed well. But a woman might not even feel ready herself to resume intercourse, and that's fine. Everybody's different, and even though you might be medically stable and stitches may have healed, it doesn't mean that you're necessarily ready to resume intercourse, and that's fine. For people who come see me after having a baby just for a postpartum checkup, it's a great way to kind of test the waters, so to speak. So just by doing an internal exam, if they're having discomfort just with that, and find that, that internal exam is painful, just with my gentle exam, which is just done with a digit. There's no stirrups or speculum. They might say, oh, if this is painful now, like, how am I supposed to have sex with my partner or with my husband? And I say, okay, so well, let's talk about what you're going to do. And then we'll go through, a variety of, educational topics and things that they can carry over with at home. And also just by doing an internal exam, if I find a patient tells me there's some tender spots, or maybe there's some scar tissue that's really causing some tightening in the muscles down there, we can work on that, and I can show them, how to work on that at home. For women who've already tried to have intercourse, and they discover that it's different and it feels painful, or maybe they have pain with an orgasm or the inability to orgasm, and they come in and they discuss all these things with me. It's just going through that examination, that evaluation process of really narrowing down, the cause, and then working on it in the office, and then giving everybody, things to work on at home as well.
So how can a husband or a male partner support their loved one through this process?
That's a great question. So when somebody experiences painful intercourse, it can really be disrupting in terms of the dynamic and the relationship with their partner. So already, especially for women who just had a baby, everything's kind of disrupted to begin with, and life is kind of turned upside down by that baby. So if they can't go back to an intimate relationship, it could be really frustrating for both partners. It could be saddening, and it could be fear provoking, and causes a lot of anxiety. So I usually tell women, if they want, when they first come see me, everybody always has the option of bringing somebody, whether it's a partner, a family member, a friend. I don't want anybody to ever feel that, they're insecure. If they want to bring somebody, they can. But then at some point, what I usually say to a woman is, if it's necessary or if I feel it's needed, bring in your partner. Let's talk about things together. Because sometimes I'll have a way of explaining things that, the woman hasn't been able to explain before. So I'll bring in the husband, and, we can have a dialogue together about how to help each other, how to get through this, maybe hurdle, and, how to move on towards, achieving that intimate relationship again, which may not be just necessarily, jumping right back into intercourse, but developing, safe, gentle touch with each other, so that the woman just is able to relax and just enjoy being touched again. If she fears pain, then the body's going to tense up. And that leads to a cycle of even more pain, leads to a cycle of breath holding. And most women don't even realize they're doing this until, I say, well, take notice of what you're doing. And then they realize, oh yeah, I'm holding my breath and my body is clenching and, my shoulders are coming up and, I'm tightening my pelvic floor. And I said, okay, so then we need to just take a step back, and having the partner come in and just learn all this is really great. And the partner can also learn, gentle ways of working, of touching actually either the genital region or elsewhere on the body, just to help the woman, feel more comfortable, and it helps her with her progress in therapy. It's a lot to process. If you've been with somebody for a while and then, your intimate relationship has just drastically changed, especially because, with a new baby, you're tired, and, it's not as spontaneous a time as it was before. So, you basically work to find time to be intimate with your partner in the schedule. So whether they sent the baby out with family or with a babysitter, just to, have 5 minutes alone with your partner. And then, then you say, all right, we can finally be intimate together. And then if that can't happen, it's really frustrating and can be a source of, stress in a relationship. So having the partners come in and just learn as much as they can. I always say knowledge is power. So I think the more education we give to the partners, the better, so that they can support the woman. You don't want her to feel alone. We want her to know that, there is improvement that's going to happen and that you have everybody's support.
Yeah, this is definitely a disease process that not only affects the patient, but the people they love the most. So providing their spouse or the significant other ways in which they can support them is really helpful and empowering.
Yes.
You gave us a lot to think about. How can people contact you? How can they get in touch with you? How can they learn more from you?
So definitely following me on Instagram. My handle is Marina C, Pelvic PT, and my website is marinacpt.com. And just, coming, on social media, I try to put out as much content as I can with good information for the general public. So just, getting out there and learning as much as you can is really great.
Well, as always, thank you for having the time to speak with us, because this is something that I'm sure women will find very helpful.
Okay, I hope so. All right. Thank you so much for having me.
Bye.